In this presentation, I will summarize the various problems a radiographer may encounter when using grids. This is the fourth in a series of presentations that deal with the unique requirements of grids. Before we start, I want to take a few moments and define a term that I will use frequently in this presentation. It is grid cutoff. Grid cutoff occurs when a grid stops some of the remnant radiation from reaching the image receptor that should have been allowed to pass. A grid is supposed to stop scatter radiation from reaching the image receptor, not information-carrying remnant radiation. Grid cutoff is an area of image reduced density seen on the sides of the image running parallel to the grid strips. The image on the right simulates an extreme amount of grid cutoff in front and behind the lateral skull. This image is typical of what one might see if a focused grid were mounted backwards in a bucky tray. The two common grid designs are parallel and focused grids. Some errors are common to both designs, others are unique to one or the other. Using the wrong source to image distance is a very common grid problem. Too close to an image receptor, a short source to image distance, is a problem common to both grid designs. Matter of fact, the longer the source to image distance, the less amount of cutoff is a characteristic of a parallel grid. Whereas focused grids are set to work within a narrow range of source to image distances. A problem unique to a focused grid is the central ray must be aligned to the center line of the grid. This is one of the reasons when using bucky, for the first step in setting up for a position is to align the tube to the bucky center. Deviation to the right or left will cause grid cutoff when using a focused grid. One can angle along the length of the grid, but not across the grid's width. In a typical X-ray table, we can angle along the length of the table, but not across its width. When doing views that involve the bucky tray, angling across or allowing the grid to tilt across its width will cause a cutoff artifact. Finally, focused grids have a tube side. This means that the grid can be mounted or used with the wrong side facing the X-ray tube. If this happens, an extreme amount of grid will be present on the image. As grid ratio increases, all problems, wrong source to image distance, off-center, angling, and backwards orientation become more severe. Therefore, I recommend low ratio or no grid for portables or out-of-bucky views. Here are two parallel grids side by side. Notice the amount of cutoff for the short source to image distance exposure. This illustrates the effect of increasing the source to image distance with a parallel grid. The cutoff decreases because more of the center ray is used and the center rays travel at less of an angle to the grid. Focus grids also have a distance problem. They only function properly within a particular range of distances. For a focused grid, the source to image distance can either be too long or too short. Of the two problems, too short source to image distance will cause the most cutoff. In a parallel grid, the longer the source to image distance, the better the X-rays align with the grid strips. For a focused grid, if the SID is too short, the outer strips will cause significant cutoff. If the exposure is made within the focal range of the grid, the angle of the grid strips are parallel to the X-rays across the entire width of the grid, and there is no cutoff. Focused grids have a definite center line. For the angle of the grid strips to correspond with the angle of the X-rays, the central ray needs to be somewhere on that line. If the central ray is not aligned with the center line of the grid, cutoff will occur. If the central ray is off-center to the right, the cutoff will be worse on the left side of the image. Before starting exam using a table bucky, center the tube to the table bucky and the grid. The center line of the grid runs along the length of the table and up and down in the upright bucky. Angling across the width of all types of grids will cause cutoff error. This explains why positions that require the use of a grid and an angle across the table do not exist. It also explains why one must be careful when using a grid for portable or bucky work. This first example illustrates what happens when the tube is angled across the grid. In this case, the tube is angled to the right of the table. The cutoff is greatest on the right side of the image. The second example illustrates what happens when the grid is tilted to the left, as in a poorly positioned portable. Notice the grid cutoff is greater on the left side of the image. Focused grids have a label indicating the tube side of the grid. This side must be oriented so that the grid faces the X-ray tube. Note that positioning a focused grid to the wrong side facing the tube causes an extreme amount of cutoff on both sides of the image. Of all grid-related problems, this is the easiest to diagnose because of the extreme amount of grid cutoff. It comes down to the question, what type of grid is most appropriate for what situation? Overall, parallel grids are more forgiving. You don't have to contend with the center line, and the grid doesn't have a tube side. They work best if the ratio is kept low, let's say 8:1 or less. And also the field width is kept below 10 inches. Given this forgiving nature, parallel grids are best suited for portable or out-of-bucky work, like shoot-through hips. On the other hand, focused grids are applications where the grid is mechanically constrained as part of a bucky assembly. One must be sure to center the tube to the center line of the grid, keep the source to image distance within the grid's focal length, and not angle across the width of the grid. Focused grids don't have cutoff at high ratio and don't suffer from cutoff on large images when used properly. This will end my presentation about grid-related problems. Thank you for your kind attention.